have to admit, I'm scared to death right now.
911, what's your emergency? There's been an accident. A rollover. One driver inside. He's awake, but he looks dazed. Please send help. 22-year-old male restrained driver in rollover motor vehicle accident. Airbag was deployed. Patient is alert but reports headache, jaw pain, and shoulder pain. There was a suspected brief loss of consciousness. Vitals are stable. Patient has mild nausea and photophobia with no external bleeding. We'll contact his family and notify the school. Any passengers? Yes, his roommate. Less severe injuries. Currently being evaluated.
To make matters worse, I can't talk right because there's something wrong with my jaw. Imagine how much this hospital bill is gonna be, or how I'm gonna afford everything.
Leaving the debrief from the EMTs and the ER nurses, I ordered a CBC, a CT head and cervical spine, and an x-ray for shoulder and jaw. I checked for concussion and fractures, started IV fluids, and then gave Zofran for nausea and Teradol for pain with a form consult requested. I also consulted with ortho and neuro. I had the ER nurses monitor neurochecks every 30 minutes.
After being notified of new intake, I coordinated insurance approval, academic accommodations, and potential outpatient concussion therapy with the family. I also went ahead and notified the school health services for follow-up with required contact to the athletic trainer.
Zofran and Toradol were checked for efficacy from the prescribing ER doctor with NSAIDs prescribed for outpatient. There's additional monitoring parameters for renal function due to possible dehydration risk in this patient. We want to caution with any muscle relaxants due to possible CNS depression given the possible concussion that this patient may have.
My oldest nephew, JT, had been seriously hurt in an auto accident. I've been through that before with my nephew, Theodore. But hallelujah, that nurse who called wasn't making no death notification.
When the patient was cleared, outpatient concussion protocol was provided in a printed handout for the patient family. The athletic trainer and PCP are to follow with a referral to physical therapy for shoulder rehab. Financial aid resources for medical bills were provided, also referring for counseling as post-accident anxiety is very common.
I just received a triage note from the case manager for concussion return to play protocol initiation. No contact sports until completed. Shoulder rehab to start after pain management. Refer to speech therapy for evaluation for a history of hearing impairment and the dentist for possible TMJ dysfunction. I just received a triage note from the dentist reporting jaw pain with possible TMJ dysfunction. Bruising and swelling noted on right lower jaw. Limited mouth opening approximately 1 finger height. Swollen upper lip. Pain in lower jaw area relieved by rest and exacerbated by oral movements. It affects his communication and intake. Emotional problems present as a result of injury as well.
I'm Jamal Taylor, JT for short. Everything's been a blur since the accident. Slight concussion, jaw injury, shoulder injury, all these follow-up appointments. But what about my ball career? It's not just me I'm worried about. I'm not sure how I'm going to cover all these medical bills. This is the last thing I thought I'd be dealing with in my senior year in college.
Patient care
It's hard work.
But we couldn't have done it without
building bridges across disciplines.